from the Women in. I'd like to welcome you to the session hosted by Women in STEM Australia today. First of all, I would like to do acknowledgement of country. I'm speaking to you from Sydney in New South Wales, which is in the land of the Gadigal people of the Eora Nation. I pay my respect to their elders, past, present and emerging, and extend that respect to other Aboriginal people and Torres Strait Islanders who may be attending today. I also recognise the various traditional lands on which those of you who are speaking today and who are listening located, and acknowledge their custodians too. This free online panel on menopause workforce impact is sponsored by the Australian Government, Department of Industry, Science and Resources. We really thank them so much for being able to make today happen. This is an extremely important topic, as you are aware, and this is about understanding and how to support your team. Because if you're not aware, women of menopause age are the fastest growing workforce demographic. By 2030, 25% of the female population in the world will be menopausal, and symptoms can result in women leaving the workforce and not seeking promotion. With a STEM skills crisis upon us, organisations cannot afford for their experienced women to be leaving the workforce early. I would like to introduce our panel members for tonight and thank them very much for taking time out of their evenings as well to be with us today and answer your questions. First of all, I have Dr. Kelly Teagle, founder and principal of WellFem Women's Health Services. She's graduated in medicine from the Uni of Queensland in 2001, worked as a medical officer in the Royal Australian Air Force. After becoming a GP, she completed studies in women's reproductive and sexual health. At 42, she experienced an early menopause, which further motivated her to study and treat menopausal issues. In 2019, she launched WellFem, Australia's first telehealth menopause service, to help women access peri and menopause care Australia-wide. WellFem now has 15 doctors and thousands of patients across the country, and Kelly also writes blog articles and is a menopause speaker and advocate. Dr. Ifern Tan is a fertility specialist and reproductive surgeon. She's passionate about women's rights. She's a passionate women's rights advocate and uses her platform as a health educator to fight for gender equity and closing of the gender pay gap. Dr. Ifern is a fertility specialist, reproductive surgeon based in Sydney CBD and North Shore. She's an accredited obstetrician, gynecologist, dual fellowship trained locally and internationally in advanced laparoscopy surgery, and has a master's degree in reproductive medicine. She splits her time between her heavy, busy private practice, public health care at Royal North Shore, and as a mum of two assertive, inquisitive and confident preschooler girls. Thea O'Connor is a wellbeing and productivity advisor and coach. Thea is a senior advisor on workplace wellbeing and productivity, a TEDx speaker and founder of Menopause at Work Asia Pacific. Based on her own research into the needs of midlife working women, Thea has crafted a range of services for workplaces to help them become menopause friendly so that women can achieve their full career potential. And she is leading Australasia in this space and has worked with a diverse range of organisations, helping them normalise conversations, embed menopause support at work so that midlife women feel safe to ask for work support when they need it. She brings a depth of experience in consulting, drawing over 25 years experience in health promotion, women's health and nutrition as a dietitian, body image, sleep science and workplace health. Lynette Wesley is a team leader in organisational development. She graduated from Monash Uni with a double major in psychology and sociology. Her interest in people, interpersonal dynamics and the impact that leaders can have in a work environment has led her to work across many sectors in learning and organisational development roles. Lynette is a passionate advocate for diversity and inclusion. She led the design and implementation of the Gender Equity Action Plan for Sustainability Victoria, and as part of that work was a key driver of the implementation of the menstruation and menopause wellbeing policy. The focus of her work has been on gender equality, also includes the intersectional lens, ensuring all voices and lived experiences are heard. Lynette's passion for developing and supporting leaders are progressive and impactful, and provided her the opportunity to have many conversations to support leaders. She's a mum of 2 boys, a 14-year-old navigating complexity of teenage life, and an 8-year-old looking up to his big brother. Right, that's our introduction of our panel. And I would very much like to start off tonight by asking, I guess, each of our panel members how you help women with menopause. So if I could start with Kelly Teagle.
Hi, everybody. Thanks for inviting me along. How do I help women with menopause? Well, as mentioned earlier, I got the idea to start up WellFem because of the fact that I recognised fairly early on in my menopause work that women could travel quite a long way to try and access care. And you know, it was the sort of consultation that was very well covered by using the phone or video, mainly around the history and giving them a bit of expert advice, because most of these people are well looked after by their GPs already. So, you know, it was, I think WellFem does its thing in really being able to provide access for women, regardless of where they live and where their doctors are, to be able to get good quality menopause care. The other work that I am quite involved with at the moment is advocacy work. For example, with the Senate inquiry, you know, putting in submissions to that. And last year, along with a lot of my expert colleagues, we did a presentation at a parliamentary roundtable about menopause. So I'm very, very, very passionate about that sort of stuff at the moment as well.
Oh, sorry, Dr. Iphone.
Hi, everyone. Thanks for including me, inviting me along tonight. So I'm a gynecologist with subspecialty training in fertility management, reproductive surgery, and your reproductive organs, your uterus, fallopian tubes, and ovaries these are all highly sensitive to hormonal fluctuations that occur in the perimenopause. So a lot of the women I see are perimenopausal because this is when a lot of the issues arise, things like fibroids, polyps, adenomyosis, endometriosis, ovarian cysts. I have a particular interest in period problems, heavy irregular periods, and period pain. And this is because I'm one of the few gynecologists in Australia with training and equipment to manage the assessment and treatment of this in my private rooms. Or if you happen to live on the Lower North Shore at Royal North Shore Public Hospital. So a lot of women find me or their GPs send them to me because these are conditions that often need treatment and assessment under a general anaesthetic. I do a lot of these procedures in my rooms to give patients the options of different treatment. I see women after menopause because they've had problems with postmenopausal bleeding, and through my fertility practice, another thing that's sometimes overlooked is the early menopause patients, women who've gone through menopause earlier than expected. They might struggle to conceive, so I see them on my fertility practice, or treat them. The women that are going through menopause a little bit earlier need a slightly different approach than the traditional woman that's in her late 40s or early 50s.
Great, thanks. Thea, how do you help with women with menopause?
Yeah, hi everyone, and thanks for having me as well, Natalie. I guess I help women in 2 main ways. One is at an individual and one's at an organisational level. So for individual women, I do one-on-one menopause coaching and also run programs for working women to help them navigate the menopause transition with confidence. Then at an organisational level, I help organisations look at how they can embed menopause support so that women feel comfortable to speak up and get the support they need if they need to. So that could involve assistance with policies or a policy review and looking at embedding menopause. Could be briefing of leaders or training of managers, as well as just general staff education and resources.
Excellent, thank you for that. And Lynette, how is it that you're able to help women with menopause, I guess, in the workplace?
Thanks, Natalie, and thanks for having me along as well today. Unlike my amazing co-panelists, my role is slightly different. It is very much at a policy level, but also in the diversity and inclusion space, ensuring that everyone can feel themselves and bring their whole selves to work, and that includes those, going through experiences of menopause as well, and understanding and working with them to support them in all the ways we can, creating a psychologically safe place in the workplace where they can share their experiences if they choose to, but also feel that they can, their confidentiality and their privacy can also be respected as they go through what might be a very difficult time that's impacting their work, but also give them the support they need. So it's in a slightly different way.
Excellent. Thank you, ladies. Very important work that each of you do, all on a different way of supporting women with menopause. Can I start, Thea, with you've been through menopause and you've had a bit of a journey, and we'd love to hear from you as to, what happened and are you out the other end, or are you still going through it? And how is that, I guess, helped with what you do?
Yeah, thanks. So I'm 58 now and I am postmenopausal, and it's good here, guys, if anyone's worrying. So at about the age of 53, 54, I hadn't had any hot flushes or anything like that, but I did start to experience brain changes, particularly forgetfulness, find it difficult to find the right word in conversation. My daughter, for example, loves telling people the time when mum said, "Amelia, can you put the violin in the oven?" And I didn't even realize what I'd said. Not feeling as motivated as usual. And all of those brain changes were quite disturbing, because I do quite a bit of presenting and training like this. Also experienced quite a lot of hair loss as well. And I guess the thing that really struck me in retrospect was despite having worked in and around women's health for 30 years, despite being well educated, got a couple of health degrees, I had no idea that it was perimenopause. And then even when I did start joining the dots, even 4 years ago, brain fog wasn't really recognized as a symptom. And the experts are still arguing amongst themselves as to whether it's real or not. So it was very destabilizing. And it did make me worry about my ability to keep running my own business. But I guess through sheer determination and a doggedness and an ability to do my own research, I'm really glad I had a bit of a stint as a health journalist, because that trained me in just picking up the phone to anyone to find out the answers to the questions that I needed. And I was lucky I connected with, Professor Kulkarni and Carolyn Gervich from Monash Uni, who are the experts in this area. But it took me about 3 years to find all the answers that I wanted to understand what was happening with my brain. And I learned, it's really common. About 60% of women at least will experience this. And it's generally temporary. So the main thing is don't stress, because anxiety will impair cognition, and put in place some brain-friendly strategies, to help you through. So my symptoms were not severe. They were in that mild to moderate category. But the significance of that is your symptoms don't have to be, severe to really put you off your game, because most of you are holding down demanding jobs, and it only takes a little wobble for you to start, second guessing yourself. So no education, blindsided by the symptoms, professional confidence taking a hit. And as I said, it was only through a process of my own research and determination to enjoy my third act. Like, I knew that I was coming into the best stage of my career and I didn't want to miss out, that I managed to put in place enough self-support and find a good doctor like Kelly and to get me through. And things are better now, word-wise, but, I'm 58, I'm nudging 60, and most people at this age will, be a bit challenged by remembering people's names and things like that. So that was my experience, and it's so common. Not being educated, not finding a doctor who knows what's going on, starting to second guess yourself. There's nothing unusual in my story, unfortunately, because we women don't get the talk about what to expect.
I have to agree with you on absolutely everything you said, because I'm going through it. I've been going through it for a while. I thought I was going for early onset of dementia. This brain fog, where you've said that, the experts aren't sure about, I'm sorry, I've had it. It's real, so real it's scary. Same deal. Thought about whether or not I would continue running a business, because you just lose words in the middle of your sentences in front of clients, and it's scary.
Yeah.
Kelly, it would be fab to hear. I know that you have a story there, and it would be great for everybody to hear what you have to share on the subject.
Did we have to hear from Lynette first about how she helps people?
We've done her.
Oh, we've done Lynette? Okay. So that's my menopause brain for there, isn't it? Sorry, repeat the question, please, Natalie.
Sure, not a problem. It was your personal menopause story that you're happy to share, parts of it.
Yeah.
So, yeah.
Exactly. Yeah. No, I was talking to Natalie about this earlier today, in fact, and it's all very much tied in with the reason why I decided to start WellFem in the first place. So I had a 1-year-old when I was, my son was born when I was 40. So at the age of 41, 42, I got this 1-year-old child and a 4-year-old as well, going through a very messy divorce, stress, trying to work too hard and worried about my future. And, when I started to get some, irrational kinds of mood swings and teariness and felt like I just wasn't coping, I just assumed it was all tied up with my circumstances at the time. As a woman's doctor who works in women's health all the time, I'm, of course, aware of menopause itself, but in your early 40s, who's going to think of that right away? And I had a Mirena IUD, so I wasn't getting any periods either. So I didn't really get the visual clues of anything going on, particularly with my cycle. So it wasn't until I started to get hot flushes that I started to put the dots together and realize what might have been going on, and got some tests done, which we do for women who are exceptionally young when they're going through the menopause, just to confirm the diagnosis. And then I was lucky enough, because of my connections and work in women's health, to be able to get some really good treatment early on. So having gone through that experience myself, trying to do my job, trying to concentrate, and, as you see, word finding difficulties, trying to talk to my general practice patients, or doing surgical assisting, as IFEN will attest to, in surgery, when you're all kind of scrubbed up and everything, and I'd have rivulets of sweat running between my boobs. So it was not pleasant at all, but it was really lovely to be able to get that identified early and get onto the right treatment early. So I think knowledge is power in this space, and I think just the act of us all being here and talking about it right now and bringing that awareness into our workplaces will make it so much better for other women.
Excellent. Thank you, Kelly. I am going to start with some of the questions that we have from the audience. So when people registered for this session, we asked them if they had any particular questions of the panel, and we've gathered those particular questions into menopause and health, coping with the symptoms at work, and then also, on that organisational side of things. And so I might start with some of the symptoms in terms of knowing that you're in perimenopause or pause. So Dr. Ifern, if you would like to start us off with, how do you know that you're in perimenopause or menopause? What sort of symptoms are common or not so common?
So I suppose we should start with what exactly is menopause or perimenopause. So menopause is when you've had your last menstrual period. It's one moment in time. And you actually only know a year later, when you've had no periods for 12 months, then you go in hindsight, oh, okay, that was menopause. Whereas perimenopause is the 5 to 10 years leading up to that last period. And this is the time of hormonal fluctuations. And so most of the symptoms and issues that are associated with the menopause transition come in this perimenopausal time. And the ones that are really common are things like hot flushes and the brain fog that we've heard about. So not just a brain fog, but like cognitive changes as well, memory, as well as word finding problems. I've got that now. And And then there's also a lot of women suffer from genitourinary symptoms, and so that's going to be things like vaginal dryness, or problems with enjoying sex, or problems with bladder, incontinence, prolapse. All these symptoms come as they're symptoms of that perimenopause hormonal change. Then we get more consequences of it, so less so symptoms, but consequences or complications. And this is the hallmark of perimenopause in terms of the period irregularities. So a lot of women get irregular periods and really heavy periods, as well as there are more conditions that because of the hormone changes that can arise during that perimenopausal time that can contribute to this. More painful periods, problems with the uterus, problems with the ovaries. They're probably the main things that that we see in that menopausal period.
Kelly, did you have anything to add to that at all?
No, I think that's a good overview. I mean, what I would say though, as I mentioned earlier, is we don't often just do blood tests to diagnose menopause. A lot of patients who come along for menopausal treatment, and particularly if they've been a little bit over-serviced by other sorts of organizations that are less evidence-based, let's say, they might be repeatedly subjected to tracking of their hormones or something like that unnecessarily. In fact, there's very few situations where it's going to be relevant to be checking their blood tests. One is if they're particularly young and we want to confirm the diagnosis, or if there's some uncertainty about whether they're actually menopausal, and that's a consideration for, say, contraception. Or if they're not responding as well as we would expect to their medication, we want to make sure they're absorbing it. So there's a couple of situations, but on the whole, menopausal treatment and perimenopause is all about the symptoms. And so, you've got the menopausal transition, you've got your perimenopause going into when you actually stop ovulating, and thereafter it's called postmenopause. And I would say, with regard to the symptoms, that it's that hormonal chaos in the time when your ovaries are starting to wind down their functioning. So you can get quite sporadic sputtering of the ovaries as they sort of pop out eggs at random for a little while, and that causes a lot of hormonal chaos that impacts on your brain chemistry. So it tends to be the perimenopause where you're getting the worst of the mood symptoms, particularly. A lot of women complain that they're getting much worse premenstrual moods, migraines, rages, sometimes for the first time in their lives. And thankfully, happily, postmenopausally, I do find that the trend is for women's mood and brain chemistry to be much more stable.
Thanks. Dr. Iton, can you tell us about the health implications of menopause?
Sorry, I'm trying to negotiate the whole mute, unmute, mute, unmute.
I know, and I'm trying to navigate the questions, making sure that I can see them and ask the appropriate person, because we've got letters on the ends of them.
Yes. So the question was about the health implications of menopause.
Yes.
Yeah. So with that hormonal craziness, I guess, that comes. So one of the big differences between men and women is men have this like slow, gradual decline and in their hormonal patterns, whereas menopause for women means that we kind of go like this, and then it all switches off, right? It's not quite as sharp as that, but it is quite a sudden drop off, and so we don't get any kind of transition, and that's why a lot of the symptoms can come on quite suddenly and quickly, and we're not ready for it. But some of the consequences are things like, because of the loss of estrogen, estrogen is really important for our bone health. So things like osteoporosis and osteopenia, you're more likely to then get bone fractures as well. And this can be as simple as like tripping over a rug and then all of a sudden you've broken your hip. Like we hear about that way too often still. And then there's the estrogen is really protective for your heart. So rates of heart disease increase as well as after menopause. And then there's the, I don't know, I find it hard to separate between like symptoms and complications of menopause. It all kinds of ties in together. So there, and the only thing I'd say is like the only other thing I'd say is it's not quite a complication of menopause, but just something to be aware of is with menopause comes another transition in women's lives where things like cancer becomes a much bigger risk for them as well. Purely by being menopausal, your risk of a lot of cancer being a potential cause of any health issue increases significantly. For example, a growth on the ovary is most likely benign if you're premenopausal and 3 times more likely to be cancer if you're postmenopausal. Same with if you have a growth in the uterus, same with if you have like a fibroid. All of these increase significantly as well after menopause.
Kelly, did you
Can
have
I
anything
just
to add?
add to that? Yeah. What I would say about it, and one thing that I really feel very strongly about is we know that the lowering estrogen levels have all of these knock-on effects in terms of decrease in bone density, increase in your risk of cardiovascular disease, diabetes, a range of chronic health conditions, dementia. So, you know, it's the thing to recognize, though, I think, is that there's a great opportunity in this if we are well informed. Because the thing is, if you find about those things in 20 or 30 years' time because you've had a catastrophic hip fracture, it's all too late. But if we all know about it right now when we're entering menopause and we know, you know, what our risk factors might be, we know to do the screening and talk to our health professionals, it's actually a really great opportunistic time to grab hold of those things and start making the very small changes now that you can to prevent that stuff from happening. So yeah, Thea and I work together on a project called Next Phase, which is a women's wellness program. And this is exactly why we do it, because we want to help women to recognise and get onto those things now so that we help to prevent a lot of chronic disease later on.
Thea,
Yeah,
would you like to tell, sorry.
Okay.
Thea, would you like to tell us a little bit about that wellness program that's able to help in this sort of circumstance? Off mute though.
Kelly is the creator of the program, so she's definitely got the big picture, but I'll just throw in a couple of lines. It really does present that model that this is menopause is a window of opportunity to build your cognitive health, to, you know, address your metabolic health and to set yourself up for a great third act, basically. So heaps of other great medical advice. I've got a physio, exercise physiologist, dietitian, and I do the more habit change and kind of psychology side of things. But it's a very comprehensive 9-module program. It's amazing the value that's in that period of time. But Kelly, yeah, you're the creator of the program.
Yeah, I know. I really wanted not just to be able to treat women's symptoms at this time of life, but actually, you know, once they're feeling better, how do you then convert that better sleep, extra energy into knowledge and action that's going to give them a much healthier, happier, longer life? And that's what it's all about.
So I guess the next question is coping mechanisms with menopause. So I'm going to open this to any of you to answer, whoever wants to go first, I guess, but how do you cope with menopause?
Well, I'll jump in because no one else is talking. And I'm
Excellent.
sure the others will talk about the more physical aspects. 2 things that I found really helpful and that I teach in my programs as well is the first one is just cultivating a supportive mindset, because there are so many negative stereotypes out there that when you start to experience the symptoms, you can truly believe in all those negative stereotypes. You can start to think, oh my God, I'm past it. You know, I'm all dried up and I've got no value anymore. So I think you have to actively cultivate a mindset that can get you through the ups and the downs. Now, for those who are really struggling, they're not going to be able to embrace menopause as, oh, my, you know, pathway to empowerment. but you can embrace acceptance, and just stopping the fight, that in and of itself can really help. So you stop fighting menopause, you kind of put on your seatbelt, you sit back and go, okay, I'm going for this ride. So it could be anything from acceptance to, yes, this is a great opportunity to examine what needs to change. You know, it wasn't called the change or anything. You know, it could be, you just have a simple model of reverse puberty. Okay, puberty was bumpy, but everyone accepts it and no one shames it. I need to be kind to myself in a similar kind of way. You know, I won't go on, but finding a mindset that will support you through. Otherwise, the world will tell you who you are as a menopausal woman, and that's not always nice. The second thing that I did was, as well as all the physical health stuff, I really used my symptoms as a nudge to inquire more deeply, what do I need to examine, you know, at this time of my life? Because I remember one of the interviews I did with women going through menopause, and she said, if you don't do the work, as in the inner work, menopause will bring you to your knees. It's like, oh, that kind of put the wind up me. So I thought, right, what's the stuff I've been brushing under the carpet or putting off or delaying? And I booked in to a psychologist and really got stuck in. So I think it's a really great time to clean out the closet and, yeah, address the stuff that you've been putting up with. You know, menopausal rage, yeah, it's hormones, but it's also because you've been putting up with a lot of stuff. Yeah, address what needs to be looked at. So I like working with the psychology of our symptoms as well as looking at our mindset. And I think they're two things, apart from the health stuff, that can really be supportive.
Anyone else on the panel like to respond to how do you cope with menopause? And it doesn't have to be personally, but how do others cope with it, or what other coping mechanisms there are with menopause? Me personally, I go the hormone replacement therapy, which I think is a good thing to start discussing because I've been off with the fairies for a while, and I'm owning it and making sure that there's more awareness of it out there to get rid of all of this taboo subject on the matter. Can we, Kelly, are you able to talk us through hormone replacement therapy and, you know, what are the goods
Sure.
and bads with it?
Yep. I mean, you know, when we're seeing someone for a menopause consult, we're not like diving straight for the MHT. We're talking to them about, you know, how holistic the whole thing is. You know, as I've said before, you're not just you aren't just the perimenopause. You're also a mother or a wife or a, you know, an office manager or this or that. So all of these things are contributing to your symptoms, and they're going to be part of how you need to manage the symptoms as well. What's the easiest thing of all, which I absolutely love, is if someone comes to me really straightforwardly with really dreadful hot flushes, because I know that estrogen therapy, if that's the cause of their flushes, is going to be like 95% effective at managing their hot flushes. So that's an easy one. And as well as that, they get that potential benefit to their heart, bones, and brain that we were talking about before, that can, because when your natural estrogen is falling and you're getting those consequences as you age, if you're on MHT for managing your symptoms, you actually get the benefit of health, you know, health support from helping to prevent that rise in heart disease risk or minimize it, and to keep your bones nice and strong. So that's an easy one. Just the flushes is the most straightforward. But the other stuff, you know, the psychological stuff, you know, the vulvovaginal dryness, actually, that's a really good one too, because, you know, we know if that's due to low estrogen, that the application of vaginal estrogens is incredibly effective. It can be life-changing, you know, using that plus good vaginal moisturizers or lubricants. So those sort of physical symptoms are much more easy to deal with than the sort of more holistic stuff like mood and sleep problems and brain fog and those kinds of things, which generally take much more of a kind of a multidisciplinary approach, I suppose, and to look at all of the different causes and put all those together. So yeah, do you want me to speak more specifically about MHT? I mean, how it's used or anything, or I'm not quite sure how deeply you want to go here.
No, well, we have been asked what are the health risks of using it in terms of hormone replacement therapy.
So I guess it comes down to risk versus benefit in any decision about medications. And all of the international menopause societies are unanimous now in stating that for the majority of women around menopausal age, that MHT is pretty low risk. You know, for the vast majority of women, the benefits will outweigh the risks. There are some women who can't use it because, say, if they've had breast cancer, or particularly if they have an active cancer, a really active autoimmune disease or heart disease. So there are a few conditions there, you know, if they had an active blood clot or something. But a lot of the things that women get told by their GPs are going to stop them from using MHT are actually not entirely true. So just because you have migraines does not mean you can't use MHT. Just because you've had high blood pressure doesn't mean you can't use MHT. Just because you had a blood clot after you broke your leg 5 years ago doesn't mean you can't use MHT. It just comes down to making sure those things are well managed and that there's not something else going on. But we do have some really good low risk body identical hormones, which is body identical just means it's identical in structure to the same molecules that are produced in your ovaries. And so it's about as natural as it comes when you think about it that way, as opposed to bioidentical, which are things that have been compounded and haven't had any testing, or as in haven't had big trials to monitor them for their safety, effectiveness. There's no consistency kind of regulation of them, and we really can't be sure what the benefits and harms of those might be. So we tend to steer away from I guess bioidentical and more towards the body identical TGA approved products these days. So I guess the bottom line is, when it comes to MHT, you know, I would not settle for necessarily just being fobbed off if you have a doctor or a clinician who's not very knowledgeable about it and telling you no. Do your own research, advocate for yourself, get a second opinion, because we do have this window of opportunity with MHT, and it's safest to start using it early around the onset of menopause. Because if you leave it for 10 years post-menopause and you're still having terrible hot flushes, it's too late to start. It's not safe to start it that late.
Can I just ask, what is MHT?
Oh,
What does it stand for?
Menopausal hormone therapy.
Right, excellent, right.
It used to be HRT, now they call it MHT. Yes.
Right, that's me calling it the wrong thing. Excellent, no problem. Dr. Ifern, did you have anything to add to that before we moved on to the next question?
No, I think Kelly's covered it really well, but I guess it's just to reiterate that there are so many different preparations out there, and that, you know, come and speak to speak to your GP or your gynecologist, and we can like assess what your symptoms are and see and your other like medical problems, and see what would work best for you. And it may not be like, and if you are worried about MHT or HRT, then there are some non-hormonal options as well. But it is for most women, it is very safe. And then working out, you know, which preparation is right for you. Lots of things that go into it, but there are so many. There are lots of different options available.
Awesome, thank you. Right, okay. So if I'm a woman, how do I prepare for menopause now that I'm in my 40s? I'm not sure who to put that one to. Is that a Thea question, or?
What was the very start of the question, the first part?
Yeah, the start of the question is, how do I prepare for menopause now that I'm in my 40s?
Well, I love that question. And my main response would be prepared, not scared. And some of the things I'd be doing from a more, you know, lifestyle perspective, well, probably number one, find yourself a good women's health doctor now before you even enter menopause, because it takes women often so long to find good help when they need it. So start hunting around and really do a little audit of all those fundamental healthy lifestyle behaviors, you know, that we've all been told 1,000 times. Eat your vegetables, exercise. And because if you look at the research, you know, the healthy diet does play a significant role in ameliorating the symptoms. If you know you're feeling a bit addictive around caffeine, alcohol, sugar, most of us have got something that, you know, we're a little bit attached to. Most of those substances don't help with the symptoms. So, you know, put yourself in a little program now rather than wait until you get into the thick of it. And try looking forward to it. I know that doesn't seem to concur with what we're talking about here, but because there is good research that shows that more positive attitudes towards aging and menopause are not only associated with less severe symptoms, but also seem to predict it. So just examine your mindset around it. And what helps is if you understand that there is a purpose to menopause, it is a transitional time taking you into a next life stage where women can be more in their authority than ever before. You know, for working women, postmenopausal women can make kick-ass leaders. You know, you're not worried about people pleasing anymore. You're much better at speaking up. So try looking forward to it would be another suggestion. And yeah, you know, start tuning into podcasts and reading about it. But a bit like pregnancy, you know, you don't want to read everything. Otherwise you might end up, you know, fearing the worst. But some education. But I would just get stuck into any life issues, like relationship issues, past hurts, go and see a psychologist, start dealing with them and addressing your lifestyle and find a good women's health doctor. That's how I would prepare if I'd had that chance. Yeah. But what would others add?
Right. Okay. And so, Lynette, in terms of work colleagues providing support to women who are going through menopause, do you have some, I guess, examples or things that you can recommend from your work colleagues, how you would support women in the workplace experiencing menopause and perimenopause symptoms?
Sure. In the context of Sustainability Victoria, where our gender composition is 70% of our organisation identifies women, and that cuts across all levels of leadership across the organisation. So a really privileged place to start from in terms of creating the space to have the conversations, to bring up these topics without that sense of feeling of it will be questioned or people will feel undermined in terms of their broader capability. So I think having senior leaders as well that are willing and happy to share their own experiences of what they're currently going through, and again, allowing that space of permission is really helpful. But what we've landed with at SB is, again, it's an opportunity. If you feel comfortable enough to share your experiences, you can, but also you don't need to feel obligated to do that. The policy allows people to take the time or the leave or work in a space or an environment for that time that best suits their productivity and what they're going through and experiencing. So I think just having those really progressive approaches to understand that we are, you know, women contribute to their work if they felt that they are, you know, are respected, can share openly their experiences without that sense of judgment. And so it's that approach to destigmatizing it that really has played a crucial role in us progressing here.
And what sort of policy, like what does the policy entail that you have at Sustainable Victoria that supports the women?
So the policy itself is menstruation and menopause wellbeing policy. So it covers the breadth of experiences, if you like, that women go through. And it acknowledges that underlying all of these experiences, you know, impacts women's decisions with career progression. It impacts their ability it has real financial implications with regards to the decisions they make as well. So the policy in itself allows that anyone experiencing symptoms of either menstruation or menopause can take the time, whether it's paid leave, in addition to other personal leave that is available, without the need to substantiate it with a medical certificate. And that paid leave can be taken to attend doctor's appointments. It can be taken just to take the time out to work with symptoms or to have that care and time to recover, if you like. In addition as well, they can work from home if it is a day or time that they would otherwise need to come into the office environment. Or if they are in the office already, we have a wellbeing room or a space where they can again, take the time they need to work through the symptoms they're experiencing. So what it allows, because and the leave itself is an additional 22.8 hours. And so the time itself, you know, is never going to be enough if someone is truly experiencing significant symptoms. And you know, we've just discussed that perimenopause could go for years. But what it does, it allows and it acknowledges that women do go through these experiences and from time to time need additional support. And it's a small step in the direction of destigmatizing the conversation, especially in a work context, and allowing people to share and openly address the experiences they're going through without any sense of repercussion to their career progression. I think that's what it's allowed.
Awesome. So you've told me in the past that your organisation has a large percentage of females. Can you remind me what it was? Was it
70%? Yeah.
Yeah, 70%. And so if you were more sort of 70% male or 90% male, do you have any ideas or suggestions about how one might approach management to be getting something like a menopause policy through and awareness and education happening in a more male-dominated area?
Great question. And it is about, as the policy is being designed and developed, and, you know, from concept to the implementation of it, taking it through and taking everyone along the journey and understanding the broader implications of, you know, having the systems and support in a work context to allow women to feel comfortable, to feel acknowledged for these experiences. So what we did, and yes, I'm mindful, you know, it's skewed the other way in terms at SV, but the reality is I would play it the same way irrespective of the gender composition, as in take the policy and the concept to everyone in the organisation, hear people out, hear the questions, the concerns, the underlying perhaps biases as well that might be playing out, and provide a space for people to be able to openly share and share and raise their concerns. In my experience, you know, some of the managers that might not have been able to take up the policy and have women in their team were curious about how they support without feeling like they were being intrusive, etc. So people genuinely want to know how to handle these situations with care and sensitivity. So it was very much about providing them with some coaching and support as well to be able to handle it and give them the sense that they would respond to this scenario like as they would with anyone coming to them with a need for flexibility in their work. And the question they had to respond with was, how can I support you with the work you have on at this point in time? And when you're back on board, we can just pick things up and move along. So without the need for any additional scrutiny of why and what the additional leave is for. So, and I think that again, we might have some very understanding leadership perhaps at SV, but I feel giving people the benefit of the doubt to embrace change and to really see the broader good and benefit of the policy is crucial. But also to not be naive about there are some underlying, you know, people that might have some questions and concerns around it. So to address that head on and almost preempt some of the concerns with, if you feel you have a question about how to manage or respond to a query for, you know, if someone from your team is requesting this leave, then I guess the people and culture function would be able to also provide that support to them. But not to take away that as leaders, they had a really crucial role in driving this policy, in promoting the policy as well. So not to give them an excuse of an out as well. So the key, just to wrap up, is to really engage everyone from the get-go rather than feel this is something we've created earlier, which allows you to filter out those, you know, any concerns that might be playing out in people's minds.
Did you get any serious pushback, or were all of the managers quite open to, I guess, exploring it and understanding more?
There was absolutely an undercurrent of, how it's 3 additional days, and some people said, well, I don't get 3 additional days, for what purpose, etc. So, and sometimes it is, again, hearing them out, first of all, creating the space where no question is off limits, and it's brave for anyone to raise their concern in a work context as well. But also the playback to that is not to it is also to go, this leave is there for individuals that are experiencing symptoms or might need that time to seek medical support and assistance, or go to a doctor's appointment, etc. If you need that for whatever other reason that's not covered in this policy, speak to us, or raise it. And so it's not about someone getting something that you don't get or receive, because that was the undercurrent of some of the questions, if you like. And so it was about saying, at the end of the day, we're all here to work and contribute. However, some people's experiences, just by virtue of going through menopause symptoms, that might not allow them to bring their best on that day. They need this time and rest. And this is just acknowledging something that women for so long had just been dealing with some quiet resolve, whereas now there is a platform for them to share and actually take the time to get the support they need. So I don't doubt there is still that undercurrent there, but I guess the approach from a P&C perspective, but just a broader cultural perspective, is just to know that the policy is in place, and their role as leaders is to absolutely back it and promote it and ensure that their people feel supported.
Excellent, thank you. I have a question that is, some women are concerned that talking about menopause at work will reinforce negative stereotypes of older women. What do you say to this? Thea, would you like to take first bat at that one?
Yeah, and this comes from, sometimes we do baseline surveys to take the pulse within a workplace, or just in the webinars that I'm doing, and overwhelmingly they get greeted with relief and gratitude and enthusiasm from the women, but there's always some who totally understandably are concerned about that. And so I guess, my response to that is, well, has remaining silent, has that helped us close the gender gap? And if you look back over the last 10, 20 years, doesn't look like that's necessarily been the solution. If indeed women are scared of speaking up for fear of discrimination, or discrimination is illegal, so let's shine a light on that and bring it out. And in the UK, there are increasing numbers of workplace tribunals, menopause related, where most of the time the employee is winning on the basis of things like discrimination. So the law is actually on your side. And I remember a comment from a British MP, I can't remember her name, but she was perhaps, in her mid-60s, and she said, we work so hard for an equal playing field, and now you are betraying everything that we worked for in asking for things to be tilted to our advantage. And look, just my answer to that is, the deepest betrayal we can commit is towards our own bodies. This is the only vehicle we have in life. And if we're not going to back our own female bodies, I think that's worse betrayal than for some cause. And I guess my last point is, when we do speak up, I do think it's really important to speak from our authority. Like, if we're speaking with apology and, behind whispers and not wanting to talk about it, what is that conveying? That is conveying this is something shameful that should be hidden. So it does take a little bit of inner work, particularly if you're wobbly with the symptoms, but see if you can speak from your value and your worth rather than speaking from your symptoms. I once had a public speaking coach who said the audience feels what you feel. So let's do that preparation so that when we are speaking up, we are conveying the worth of menopausal women. That's my response to that one. And I guess finally, as a wellbeing practitioner, what I know is that the secrecy that has prevailed in workplaces has led to an incredible sense of isolation amongst women. When I conducted interviews, women said embarrassing and isolating, they were the two most common words they used to describe their experience. And if you look at isolation from a wellbeing perspective, that's the number one killer. It's the worst thing that you could possibly do for yourself. So when I was deliberating this in the early days, wondering, shall I speak up about this? All I knew was that isolation and secrecy is not the answer. So let's give something else a crack. And that was my rationale for speaking up. And it's good if everyone can find their rationale for speaking up if that's what they choose to do. But really good question, because it's often the one people don't want to name, or it is an underlying fear that's there.
Yeah, it's definitely a fear. Every conversation that I've had since organising this panel, like I didn't know much about menopause before organising this panel. I didn't even realise that I was kind of almost there and going through it as much as I was. And I wasn't taking it that seriously. It's like menopause. I'd heard that there was menopause leave at some places. I'm like, do you really need that? And all the rest of it. But as I was getting deeper into it and experiencing it, and then realizing that my team are experiencing it, and I didn't realize as a boss or know what to do about it, then, you know, it's something that you need to raise your awareness about, you need to find out more about, and you need to support people with. And as a woman, you don't want to feel like, hey, we've just managed to come back as mothers into the workforce and we still have that as an issue. And then we're going through menopause and we're going to have this as an issue. It's just, and so there's so many women that are unaware they're going through perimenopause and that what the symptoms are, but then do we say anything about it, or do we just stay quiet on it because we don't want to look incompetent, or it's another issue to not employ women, another reason to discriminate against us? Is a real fear amongst women, as we've seen in the survey results of what we've done as well recently for the inquiry, which we will get into later. So in terms of, I'm just going back to my seriously large list of questions here to make sure that I'm going through them. What initiatives or policies can we expect from governments to address the challenges surrounding menopause in the workplace and promote greater understanding and support for menopausal employees? Who's going to tackle that one?
And look, I don't really know. I'm waiting to see what's going to come out of the Senate inquiry. You know, a number of workplace providers like myself did submit. So look, I'm all ears and all curiosity. All I can say is I know that some of the unions are meeting with the Prime Minister to try and have the menopause and menstruation leave become just as normal as superannuation or flexible work. But for me, like, I wouldn't be leading with that. Like, there's so much you can do before introducing leave. It's the destigmatization, it's the normalizing of the conversations, it's making your managers comfortable. Because interestingly, when HACSU, the Health and Community Services Union, did survey its own members, most of the women didn't want leave. They wanted just a bit of flexibility and accommodation so that they could keep working. So I think we shouldn't, when we hear menopause policy, that's not synonymous with leave. You know, there's so much else that can be done there. But look, I don't know what the government's going to come up with. What I would like is that they radically change the legislation so that, because currently it's only if menopause were deemed a disability, and that would have to be deemed by some workplace tribunal, is a workplace then legally obliged to make reasonable adjustments. I think, can't we make it more, let's just do that anyway, which workplaces can do, because then the woman gets the support she needs and the workplace is, you know, protected legally. I just, there weren't so many barriers to just doing what makes sense, which is, let's make a few adjustments here, because that can really be a game changer. But I'm not adding anything to your questions. I'll be quiet now.
It's valuable, and Lynette looks like she has something to add.
Yeah, just to add to what Thea mentioned, in terms of the leave itself, I know we do get fixated on that component. And while it's been a year since we implemented the policy as well, and about 230 hours of leave was taken over the period of time. So the leave has been important for those that needed it to attend those appointments and whatever else they needed to do during the time. But more broader flexible practices have probably been more useful and important, where it doesn't matter how I work or in what context I work. If I'm delivering the outcomes and the outputs and I'm doing it to the best of my ability, that's the conversation and focus we should constantly have. And if I have the flexibility to work around, whether it's a symptom I'm experiencing or an appointment I need to attend, all the more reason I think people want to give back to the organisation as well. So rather than wait for whole sweeping government changes, which may or may not happen, but I think individual organisations can take the lead and just understand what's in the best interest of our people and how can we really engage them and flexibility more broadly is definitely a practice that can allow that.
How do you think, this is for you, Lynette, in terms of women in any organisation where awareness of menopause and policies, etc., are non-existent, how do they bring it up with their manager? I mean, how do you be the first one to say, hey, how you going? Really need, a bit of consideration in this area. What sort of, I guess, tips do you have for that one?
Yeah. If there are other platforms or working groups or other things in place already, use that as a launching pad. Most organisations have diversity and inclusion working groups or networks that come together to raise awareness on those other aspects of creating an inclusive workplace culture. And I think maybe bringing those ideas to a group like that allows for momentum to be created, but also to not feel that it's a lone voice in this, in the sea of just keeping on and getting on with work. And again, highlighting the really practical implications of introducing, whether it's policies or practices that really acknowledge women's or people's experiences in an organisation, that really allow them to be seen and fully heard as well, and the impact that has on their engagement as well. So can't recall exactly the name, Australian Institute of Superannuation Trustees, that did a lot of research of the implications of menopause and women making clear decisions to leave the workplace earlier, the impacts of superannuation, etc. There's a lot of research you can draw on to say this is not just people wanting more leave or wanting more flexibility for the sake of it. There are tangible outcomes and impacts of people's experiences from the work context, and what that might lead to in terms of their financial independence in their future as well, in their retirement. So you can draw on what's already there, you can draw on the work from organisations that have led the way as well, and just take that step forward. It doesn't have to be perfect, is probably my only other tip. You just need to begin, and you can evolve the practice or the policy as you go along. But waiting for something that makes everyone happy might not lead to anything happening anytime soon. So I think that's probably key.
Absolutely. A question for you, Dr. Kelly Teagle, which is, how do we incentivise and fast-track training of GPs and allied health professionals, since they're going to be part of all of the education and awareness training?
Yeah, that's a really tricky one. I don't think fast tracking is really going to be the aim here. We certainly want to upskill our existing GP workforce, and we want to make sure that there is, information and training about menopause and perimenopause for the GPs coming through, and at least some mention of it, in more than just in passing in medical school as well would be good. I think the problems with getting good care and good access to GPs is really systemic. It's not just to do with lack of education in this space to GPs. It's also got to do with the GP shortages, and it's got to do with the fact that GPs don't get properly remunerated for doing long consults compared to quick turnover of lots of patients. So they're disincentivized then to actually sit down and do a very comprehensive, holistic kind of approach to menopause, because it takes too long. So I think there's lots of things that are going to need to be addressed for that to be perfect, but there's lots of things that we can do. For example, in my Senate inquiry submission, one of the things I mentioned was options to support GPs in managing their patients where they are, which will also help give GPs more confidence and bring them up in their knowledge levels as well. So things like, being able to provide rapid access to specialist advice through a phone, some kind of phone hotline service or something like that, which is, there's plenty of precedent for those sorts of things already. So, I think that there are things out there, but, we need to get it front and center in medical school, and definitely as an important part of GP training, just if for nothing else, the fact that it's such a powerful time to be able to implement, you know, that they can do interventions to help prevent so much chronic disease in the following decades.
And how do we keep on top of sleep and weight gain?
Ooh. Someone else want to take this one? That's
So,
like,
yeah.
that's 2 whole modules of next phase right there, isn't it, Thea?
Absolutely, that's big.
Yeah. Look, you know, that is, there's as many answers to that as there are women, because there are so many different causes to sleep problems and so many different contributors to weight gain. So, you know, it's certainly, I think one of the things that we talk about a lot in next phase is not worrying so much about the weight per se, and certainly not so much about the aesthetics of it, as just actually listening to your body, learning to be kind and forgiving to your body rather than punitive when it comes to your diet and things like that, and just actually nourish it, you know, like listen to it and give it what it needs. If you take a more loving approach to taking care of yourself, then that other stuff does tend to take care of itself too. And sleep, look, so many different contributors to sleep problems, but the very basic things, and, you know, so we go through this step by step, you know, could you actually have a sleep disorder that needs investigations? And we've got some tools in our program to help you to help screen for those, but your GP can do that too. You know, do you have terrible hot flushes that need managing before you've got a hope of getting a good night's sleep? Are you not managing your stress very well? I mean, the main number one reason why women get crappy sleep is because they've always had crappy sleep, not necessarily because of menopause. So that's you know, you can't expect to get a great night's sleep at menopause if you've never had a good night's sleep. So there's so many different things. I would say it all comes back, like most of the things I've been saying, to really doing your homework, being well informed, and seeking support from a knowledgeable practitioner who can help you tease all these things out, all the different contributors. And don't expect it to be a one-shot wonder, because you don't get to be, you know, 50 odd years old with all of this stuff going on in your life. You know, it didn't just happen overnight. So, you know, there's lots of habitual stuff there. There's lots of perhaps cumulative health issues that need to be dealt with in that as well. So be systematic, be patient, be loving and kind to yourself, and be persistent in seeking good care from a good health professional.
Right. I'm going to ask each of you what resources, either web links, reading, videos, that you recommend. So, because I know that there's lots of resources, lots of books, YouTube videos, you name it, that's out there. Who would like to go first for that one? Because I can see you're all thinking about it.
I'm happy to jump in.
Go for it, Thea. Gives everyone else time to talk.
Yeah,
Or think, not talk.
Apart from WellFem website, of course, which has got lots of free videos on there on all the things like HRT and all the rest of it, that's a really great start. In addition to that, my all-time favorite in terms of just really understanding the physiological changes and what you can do, which is some of the questions here today. Lara Bryden, I think, is pretty amazing. She's a naturopathic doctor, also evolutionary biologist, and incredibly evidence-based. And what I like about her is she blends the medical, so she's not anti-menopause hormone therapy at all, but also, you know, what are some of the diet, nutrition, exercise, supplements that could be used. And, you know, she's got a reference for just about everything that she recommends. So she's my all-time favorite in terms of being at the real cutting edge and really making that kind of information accessible to women. So she's got a blog, she's got a book, but she's my favorite in that regard. I'll just pop in the chat box.
You're putting it in the chat? Excellent,
Yeah.
thank you. Lynette?
Mine's one that's a bit more popular in that sense. Mia Friedman runs a podcast called Mamma Mia, and they ran a very peri-menopause summit recently, and that's what got me interested in learning more, just having a wide variety of speakers and sharing of experiences through that process was wonderful. And Oprah as well. I know, sorry, I'm picking name dropping, but don't know these people in real life, of course, but it's good to see people that have gone through these experiences but have wide reach as well, now sharing both their own personal experiences but also getting experts together and hoping that, again, brings messages of seeking support, looking after each other, and all the things that Dr. Kelly and our friend have shared today as well, with regards to what people need to do to look after themselves during this time. But those are my two recommendations.
Excellent. Dr. Ivan?
So I think one that's really, there's the Jean Hales Foundation. I think that's what they're called. But it's a really good website that goes through a lot of different women's health topics that are really aimed at the patient level, rather than, I think a lot of them, and it's Australian, which is great, because a lot of them, like especially the North American ones, like the Cleveland Clinic and everything, it's more aimed at the health professional level. And so to just get really clear, simple advice and in detechnicalized terms, I think that's a great website and resource for patients.
Excellent. Kelly?
Sorry, dropped my mouse and I couldn't unmute. Yeah, so I really love, obviously, WellFem, thank you, Thea. I love the Australasian and International Menopause Society's resources. They've got a great range of infographics, information sheets, videos for consumers and health professionals on there. The WellFem website, yes, we've got tons of stuff in our blog, and we've also got a free menopause assessment tool that gives people a little bit of sort of, I guess, screen down more individualized kind of resources and feedback. We've got the Next Phase Women's Wellness Program, of course, so if anyone wants to do a deeper dive into learning all about the physiological and psychological changes that are happening at midlife, it's a really great, very comprehensive education and support program. And I love The M Word, which is a book by Ginny Mansberg, about to come out in its second edition. She's done some updates on that. And as far as clinical things, look, there's a lot of great websites. The Healthy Bones Australia website for anyone who's got risk of osteoporosis. There is the Oz CVD risk calculator, which is a really great one to punch your own numbers into to see what your risk of cardiovascular disease and problems over the next 5 years might be, and that might spark some conversations with your GP. So I'll type a few of these into the chat box shortly, but you'll have to Google them yourself to find them, sorry.
No, it'd be fantastic if you guys can just email me the various references that you just mentioned. And what we intend to do at the end of the seminar, not tonight, we'll leave it to maybe tomorrow, is actually email out everyone who was a participant today. They will get a copy of the recording, but then also any of the resources that you guys have been providing. And I know that there's also other resources that you've mentioned prior to this that we'll also be sending out to people. And Kelly, I did watch your Menopause Summit that I think had you and Thea on it. I think I purchased it. I think it was like $20 on the web, and it was about 6 hours worth of pre-recorded material, which I started getting into while I was folding the washing. And it was really, really informative. So I was really appreciative of that
thanks,
as
Natalie.
well.
I'd forgotten to mention that one myself, and Thea was speaking on that one as well. And tons of bonus content. It's worth watching just to see Margaret Redelman talking about sex toys seriously in the bonus content. It's wonderful.
Awesome. Bonus. We do want to try and take a couple of questions if we can. There's just one question that I wanted to ask Lynette, which is, do you know of any organisations that are menopause friendly, or do any of you know any that are menopause friendly in general, but very quickly?
I want to handball to Thea, but you might be working across many more organisations there. But certainly while I was doing some research before the policy, I did find out some superannuation organisations. So financial services are progressing in this space because they want to, again, attract the best and brightest women in their patch. But certainly Sustainability Victoria, I'll give my own organisation a plug in making some great progress for a government agency in this patch. But I think, Thea, you might have some more ideas here.
Yeah, and I guess when I hear the word menopause friendly, I think of an organisation that's taken an organisational approach and not just done a webinar here or there, or
Yes,
would involve
means
both
it.
support for the individual plus looking at the environment plus educating managers, blah, blah. So those, they're probably a handful that we could count on one hand. We're probably about 4 years behind the UK, where this is much more common. But here in Australia, shout out to Queensland Teachers Union. They were the first that came on board 4 years ago when no one else wanted to talk about it. And we did take a very systematic organisational approach from the senior executive, training all managers, like we did everything. I know Red Cross are just at the start of taking an incredibly well thought out systematic approach. So they're going to be integrating it into everything, including their psychosocial risk assessment. They've got all the leaders on board. They're doing an amazing job. So I can't wait to see how that unfolds. But University of Canterbury, New Zealand have been working on this for a while. And then there are a lot of other organisations who are coming through. And I'm just finding people often start at different points. Many just start with the general staff education, but some, like New South Wales Parks and Wildlife, they've just jumped right in and they're getting a huge response from their managers. So I'm doing heaps of manager training for them, which is now leading to requests from their senior executive for a briefing from them as well. Other big government departments have started with putting people through my programs. So yeah, it's interesting. People are coming at it from a lot of different angles. And I don't know how many are going to go on to make sure that they're ticking all the boxes. But I think with particularly more conversations around things like gender equity and, particularly equal pay, menopause is all part of that. And I'm hoping that over time, workplaces will start to join the dots. So it's not just seen as a little separate wellbeing issue, but it's actually integral to both some of their stated commitments and to business success. In the context of labour shortages, retaining experienced staff is a really important priority. So
Okay.
few are truly menopause friendly, but I think we're going to see a lot more coming through in the next few years.
Okay, so I'm going to just quickly, how long do people typically stay on HRT? Is that Kelly? You're on mute. Sorry, and we only have 9 minutes, so I'm going to make these answers really quick.
That's a very individual one again. I mean, you can start to get early types of hormonal changes of perimenopause, even when you've got plumb normal periods, and it could be 10 years before you're actually due for menopause. So it depends on how severe you're talking about, but MHT, average would be about 6 to 7 years that women would stay on it for. And then, it varies from person to person. Sometimes they'll do a trial off it to see if they still need to be on it anymore. And actually they feel fine and their flushes don't come back. Other people find that their symptoms come back if they go off it, but they might be able to step it down gradually over time. But as I say to them, if you haven't got any contraindications to being on it, if you're otherwise healthy, and you're finding you're getting symptom relief, I wouldn't be in a rush to come off it, because you're getting long-term health benefits to your heart, bones, and brain while you're on it as well.
The next question that I've got here is, do you have any examples of specific strategies that help with the brain fog, lack of concentration, and poor memory? Would you like to take that one on? How do you cope? Oh, how did you cope when you had the brain fog, lack of concentration, and poor memory?
I did pop that in the chat box, but I'll try my bullet point response.
Oh, sorry, you've answered it, or?
Yeah, in the text box I have.
Sure.
Yeah.
Okay, right. So you've covered it off. We don't need to answer it again. Is that?
I mean, I could talk a lot on it, but I'm just aware of the interest of time, and I have given a bit of an overview of what I did.
Right.
Yeah.
Okay. So what it might be useful for us to do is gather these questions, and anything that we don't answer that have been put on the chat that we have to put perhaps in an email back if we miss anything here. I think we've answered most of what's here. Thea, what's your experience of promoting menopause education in male-dominated workplaces like construction or engineering?
Yeah, so I haven't worked with those industries in particular, but I have in manufacturing and law, where at the top that can be pretty rugged for women, and in some finance sectors. And in each of those, there's been one brave senior female who speaks up, and she speaks up with authority, and that's what's got it going. In particular, I'm thinking a couple of the law firms. It's been a really interesting mix in that female partners were talking about, whoa, we're really affected by this. We're pretty freaked out. Can you do something for us? But then when we ran the webinar, they didn't want to show up because it would be perceived as a sign of weakness. And then they ended up running a session for just the senior male partners of the law firm. And they popped me in a room with them and they said, off you go. And that was actually brilliant in that it was just the men. They could ask all the questions that they wanted. And we said, do you like this format for learning? And they said, yep, it's actually really good. So we might be do some more of that. So that's what I've found so far. But I spotted someone on the line who I think also works in a male-dominated industry. I hope she won't mind me calling her out. But Andrea Binks is from the Anaesthetists Association, and she's been doing some really great advocacy work. Andrea, I hope you don't mind me mentioning it, but you know, maybe people could connect with her as well, or you could share some of your work, Andrea, about how she's gone about that as well. But I think the other thing is, don't assume men won't be interested. Men often are scared of saying the wrong thing because they think they'll get their eyes poked out. But we don't give them any educational support to know how to talk about it or how to be supportive. And in fact, the first work I ever did in Australia 5 years ago, it was a male HR practitioner who opened the door for me. And so men can be really important allies. I've learned to drop all my gendered assumptions about who's going to be responsive and who's not, and develop a good business case. I mean, that's true for any person in the workplace that you want to appeal to, but develop a good business case, and also maybe think of the story that might appeal to them, a wife, a daughter, what kind of future do they want for their, you know, their bright spark daughters. So they're my off-the-cuff thoughts on that one.
No, that was fantastic. Just the realization that they could put you in a room, the guys could then all talk. The women at the firm would not feel weird being in the room discussing it with men and them feeling weird, so that they could just, no question was a silly question.
Yes.
And they could just ask you and get it out there. I think that was brilliant, actually.
I thought it was pretty true, though it did feel a bit weird at the start. I said, I bet when you got promoted to being a senior partner in law, you didn't think it was going to involve a closed door session on secret women's business. Did you? And I said, no. But once we got going and they knew I wasn't going to be too, what did they say? Oh, you weren't too woke about it all. It was all good.
Right. So a number of people have said, can you, this is across the board, if you can please put the URLs or spell the resources, etc., for any of the information, including are there any good resources for organisations which are starting to look at developing menopause policies, and can we access these publicly? I know, Lynette, you had, when you were going through the journey of putting together the policy, you were accessing, was it a government document that you were coming off the back of for developing the menopause one that you have, that you referred to?
No, I did see what else was out there, and I did leverage a general policy from an organisation as well at the time, and I guess, you know, tweaked to or adjusted it to suit what we wanted to do and how we wanted to position our policy. So there are things that people can leverage out there, but certainly I'm happy to share SV's policy as well, and the work we've done so far. The more I've kept it very simple as a policy, because again, it's a complex enough issue more broadly, and it allows people to just talk about their experiences and destigmatize it rather than get caught up in a complex policy, if you like. So happy for you to share that more broadly with the group of attendees as well today, Melanie.
Excellent, thank you. So we've got 2 minutes left, so I'm pretty much going to have to wrap up the panel. I want to thank you all for being here. It's been a fabulous night, lots of questions answered. We will make sure that the recording will be available on the Women in STEM website in the next day or a few days. and we will be emailing out to all the attendees, basically anyone that was registered as well, a link to that. But it'll also go onto social. We will be releasing soon our submission to the inquiry, where we had lots of women in STEM actually participate in that, and ABC News was actually providing some news coverage about that today throughout the day. I would like to ask you all if there's one very quick thing that you want to say that you don't think's been mentioned on menopause. And I'll start with Dr. Ifern, if you've got anything to say.
No, I think we've covered a lot of the things that I would have liked to say throughout the course of this evening. And I think, but I would just like to reiterate what, I can't remember who said it before, but education really is the key. You know, like arm yourself with as much knowledge as you can, and use this menopause time as a time to really get interested in your own health. And that's how we find ways that we can address all the health problems. So you go through menopause, you enter it in the strongest possible position. That's what I would love to see.
Excellent. Annette?
From introducing a policy or creating a culture where we are destigmatizing these conversations, I think the key is progress over perfection. Just get started. The smallest, incremental changes will add value in the long run. So that's it.
Excellent. Thank you. Thea?
I think let's remember that postmenopausal women, we're an incredible resource for humanity. So let's really band together to support each other and to help those who are having a troubled time to get through this, because we need more of us. The world needs us at the moment. So yeah, let's band together so we can name it and get the support that we need.
Thank you. Kelly?
Yeah, here. I agree wholeheartedly. Women at this stage in life are amazing. All the life experience, all the cumulative wisdom, the confidence of knowing that you can come through adversity and that you have something to offer other people. So just remember that. Just hang on to that. Don't let all of the negative things that you hear of, don't just think that because you've got symptoms that, that's a time to start catastrophizing and treating yourself like a little old lady. Like, this is the time to really take charge of it. It's a great opportunity. It's a great potential life stage. We just have to adjust our mindset and maybe, listen to our bodies about what it needs now that it needs adjusting from previously. Go for it.
Thanks very much. And thank you to all of you who've managed to stay on the line for this 1.5 hours worth of really important material on menopause and the workforce impact. I will leave you there and encourage you to join Women in STEM if you haven't already as part of the community. Thanks, ladies. Really appreciate it.